Your first lab activity will start with group palpation exercises. One person should be a physician, and another person should be the patient lying on his or her stomach. Okay, when you're ready, we're going to start with observation. Look to see if there's a color difference between side to side. Is there discolorations? Is your patient's skin dry or sweaty? Do you see any lesions? For example, you can see here my patient has lesions that you can easily identify. Now we can check patient's skin temperature. We're going to use the back of your hand. Without touching it, we can try to assess and perceive patient's temperature. Check up and down, side to side, and think to yourself, is there any difference? Now we're ready to engage the skin and subcutaneous fascia. Use light pressure just enough to redden the nail bed, and try and see if you can engage the skin and superficial fascia. Try to move your hands cephalad and caudad, side to side, to elicit tension. See if you can appreciate a direction of restriction or a direction of ease. Now we're going to apply more pressure to see if we can perceive the deeper layer, the muscle layer. The pressure you should be using should just enough to blench the nail bed. Now try to palpate up and down the paraspinals, and then try to see if you can ask yourself, is it soft? Is it bouncy? Is it compliant? Or is it hard without any give? Try to perceive the direction of the muscle fibers. Also, if you can, try to feel the direction of ease or restriction. You can also try to perceive turgor, tension, and thickness of the paraspinals. Okay, now doctors, try to move your fingers towards the shoulder blade and rest your fingers there. Patients, try to see if you can extend your arm. And now doctors, while your patients are extending their arm, try to appreciate the differences between contracted versus relaxed muscles.